before I knew it, half my law practice for the last 29 years has been trying to protect our access to natural health products and trying to protect people's health rights. But for that whole time, Health Canada has wanted to regulate natural products basically out of existence. And citizens periodically have had to stand up and rebel. But we're basically at the end game because we're so far down the road with international harmonization. This is part of, getting us all under the World Health Organization umbrella with binding regulations, and all the Western democracies, or I guess we can't call them that, all the Western countries, all under the same kind of umbrella. The regulations might look slightly different, but in essence, they'll be the same.
Tamara Ugolini here with Rebel News to bring you an exclusive interview with Sean Buckley, principal lawyer from the law firm Buckley & Co. Through his legal expertise in regulatory law, Buckley advocates for personal health rights and to protect access to natural health products. Buckley is also the president of the Natural Health Product Protection Association, also called the NHPPA, which is a federally incorporated nonprofit organization that acts as an industry watchdog to protect Canadians' access to dietary supplements and natural health products. But as detailed by Buckley, Health Canada has been targeting these products for decades, looking to regulate their use and restrict your access. And the latest attack by the federal government came by way of Budget Bill C-47, sponsored by Deputy Prime Minister and Minister of Finance Chrystia Freeland. Budget bills usually pass through swiftly, and, as is the way, this one did too, on June 22nd, 2023. Bill C-47 includes definition changes to natural health products through the Food and Drugs Act and amendments 500 to 504 specifically. The changes basically subject the natural health community to the same powers and regulatory penalties as chemical drug companies, otherwise known as the almighty and powerful Big Pharma. Mr. Buckley joins me now to discuss what this means for health-empowered Canadians and how they can take action to combat this unnecessary government overreach. Have a listen. Thanks so much for joining me, Mr. Buckley. Now, to get right into things, Health Canada is supposed to be this institution that helps Canadians achieve and maintain and improve their health. So why are they pushing regulations and legislation that essentially attacks the natural healthcare industry?
So first of all, if you read the legislation, you won't find anything about them having any duty to protect and promote health of any kind, or actually any public interest at all. And, I had a Health Canada inspector on the stand some years ago, and I said something like, well, as a Health Canada inspector, you're here to protect our health. And she wouldn't agree. And she explained quite truthfully that Health Canada is there to enforce the Food and Drug Act and regulations, not to protect our health. So that's public messaging that has nothing to do with the reality. And our drug regulations are there to protect intellectual property rights. It's actually under the federal government's criminal law power and international trade power. They don't have jurisdiction over health. So why are they attacking natural health products and taking them away when they don't even have jurisdiction to regulate them at all? I think it's part of harmonizing international regulations, and that initiative is going to privilege chemical drugs instead of, and basically exclusively. So I think it's just a part of moving us into a model where we only have one option.
Mm-hmm. And I'm glad you brought up that you had previously had a Health Canada representative on the stand, because you've been at this for decades. And so, between protecting the natural health products, the industry, even right down to freedom of medical choice, when did regulations and legislation start to come into play here and hinder this industry?
So there was a citizen rebellion in like 1997, 98, and actually the federal government was going to bring in cost recovery, which, so impose fees on natural health product manufacturers and the like, which ironically is what they're proposing again now. But people rebelled because people are touchy about protecting their right to be able to access natural remedies, as to have that choice. So they rebelled, and the health minister, Alan Rock, at the time backed down. Actually, the eve of the lawsuit. The lawsuit was going to start the next day, and then referred the matter to the Standing Committee of Health and asked, like, don't just do a cursory job, look into this deeply, tell us how we should regulate natural health products. And at the time, like they I think it was over 1,000 witnesses. At the time, it was the most comprehensive review of any issue by a standing committee of parliament in history. And that's likely still the case. And they came up with 53 recommendations. You can still find the report on the parliament website. And they were clear. You cannot regulate these products as drugs, like for several reasons. I mean, aside from the fact that they're so crazy safe, and we're talking about things that are in our food supply anyway. And you can't impose the same, standards of evidence. It's completely inappropriate, and they explain why in the report. So then, after that report comes out, for several years, there's kind of a dance between Health Canada that wants drug-style regulations and the natural health community, and then we get drug-style regulations in 2004. And it takes the industry literally probably about 12 or so years to largely comply, because before then, every product was completely unregulated. So, if you walked into your health food store, probably till about, 2012, 2013, almost, half the products or more were even unregulated then. So, around 2016, it's kind of funny. We're finally there. Like, where if you walk into a health food store, almost everything is, had to get Health Canada permission. And then the following year, 2017, Health Canada tours the country announcing we're going to throw all of this effort away, and we're going to impose this, they call it the self-care framework, which is what we're experiencing right now. So that basically, no, we're going to regulate them like chemical drugs, like we wanted to from the beginning anyway. And so we're in this process of harmonization. So it's really kind of quite spectacular that we've gone through 2 citizen rebellions, actually, to try and keep Health Canada in check on this issue. And here we are at it again.
Well, and so that before we lead into the call to action, because you are wanting citizens to become more informed and to ensure that they have their voices heard and exercise whatever democratic right we have left in this country. But before we get into that, you said something interesting there. Pharmacizing, I think was the word that you used. Pharmanizing the healthcare, the natural healthcare industry.
I meant harmonizing, but actually, if I misspoke, if that was a Freudian slip, it was an appropriate one, and I'm going to have to remember that, because I've started. I got my first involvement was in 1994. I was acting as counsel for Health Canada against a herbalist at the time. And then I ended up acting for the herbalist the next year on a different issue. And before I knew it, half my law practice for the last 29 years has been trying to protect our access to natural health products and trying to protect people's health rights. But for that whole time, Health Canada has wanted to regulate natural products basically out of existence. And citizens periodically have had to stand up and rebel. But we're basically at the end game, because we're so far down the road with international harmonization. This is part of, getting us all under the World Health Organization umbrella with binding regulations, and all the Western democracies, or I guess we can't call them that, all the Western countries, all under the same kind of umbrella. The regulations might look slightly different, but in essence, they'll be the same.
And just to lean on that verbiage, how is this pharmanization or this pharmaceutical model, how is it going to compromise not only the availability of natural health products, and so whether that be herbal remedies or your supplements or homeopathics, but how is it also going to negatively affect the practitioners that practice in this industry?
Oh, no, that's a super question. So there's a whole bunch of things that are going to combine to basically take products away. So one thing that's happening is cost recovery is back, even though they tried in 1998 and actually a few times since then. So they're going to impose cost recovery on the industry. And right now already the margins are extremely tight. So that's going to drive the small and several medium players out of business, which then will reduce products. It's also going to drive the prices up. And we're already in a situation where natural health is a, middle and upper class privilege. Like people in the, that are economically disadvantaged can't access them right now anyway. Now, another interesting thing about cost recovery is Health Canada saying, well, we're going to be taking this chunk of money, and we're talking hundreds of millions of dollars each year, and we're going to create a new enforcement arm. And these enforcers are going to go out in the marketplace and basically censor us. Because Health Canada takes the position that the only thing that can be said about a product is the approved label claim. So, I'll use Empower Plus as an example. It's probably the best treatment for bipolar disorder in the world. And I say that after, listening to Harvard psychiatrists and the like testify under oath on these issues. So, well, they can't tell you it's for bipolar disorder. All they can say is I think the label claim, which is something like supports mental health and well-being. Now, there are 35 published peer-reviewed studies, all funded by governments, including, one by the Alberta government, and but from countries all around the world, that the company didn't fund or participate at all, and it's just because the product's so cotton picking effective, right? Well, and they're in peer-reviewed journals like Journal of Psychiatry, Journal of Adolescent and Child Psychopharmacology. We're talking the blue chip journals. It's illegal for True Hope, according to Health Canada, to even share that those exist, let alone tell you what they say. And so we're going to have this new enforcement arm basically enforcing this type of thing. Now, what just happened with the budget bill is Health Canada imposed really strict penalties. So for a natural health company, before June 22nd of this year, if you crossed Health Canada, you would be looking at a maximum $5,000 fine per offense. And an offense could, let's say you ran an ad for a month and they didn't like it. Well, that would be one offense for the whole month. Now it's $5 million per day that you're in violation. So True Hope, using them as an example, they had those articles posted on their website. They just took them down because now they're facing $5 million a day fines. So you see, before, practitioners and companies, they could do the right thing and share truthful health information because they knew they could survive. They could be hurt, but they could survive. But now, when penalties get so strict that you can't resist them, you're in full tyranny zone. And we're so far past this. This isn't meant to be punitive. What natural health practitioner or natural health company can withstand $5 million a day fines? It's just silly. The other thing that's happening is right now, under our natural health product regulations, you can get a license for basically any condition. Now, they limit us to what they call structure function claims, and that's just a policy decision. But they don't limit those claims to say, well, it's only for really minor things like a skin rash or something like that. But under this new harmonization, they're saying, no, we really are limiting it to things like skin rashes. So only things that if you went into a drugstore or health food store that you would just get because, oh, I have a skin rash. It can't be for any condition for which you would go to a healthcare practitioner. So, well, that's our naturopathic doctors, our homeopathic doctors, our nutritionists, our traditional Chinese practitioners. So if we're not going to license these products with structure function claims for those conditions you'd see a healthcare practitioner, then what's going to happen to those products? And another thing that they're bringing in is right now, you can use traditional use evidence. So, I mean, in the traditional Chinese practitioner model, they have traditional use evidence going back thousands of years. And also in the herbalist model, and definitely a lot of traditions for centuries and centuries. I like to use scurvy as an example. So let's say we had a total economic collapse and, a currency crisis and international trade dropped, and all of a sudden we're not getting citrus fruits and Canadians are eating, meat and potatoes and getting scurvy. And you and I thought, well, we better, Tamara, we better deal with this. Let's get a rosehip tea high in natural vitamin C and sell that to treat scurvy. Well, right now we could use literally the British naval records where the British sailors were, the fighting ships actually couldn't fight. The sailors would be so sick with scurvy. It was a national crisis. And then they learned, well, there's no vitamin C in their diet on these long ocean voyages by sail. So they added limes to their diet, which is why British sailors were called limeys, and problem solved. So, I mean, we could actually today use those records to get, approval for a high vitamin C supplement to treat scurvy. But we're entering a world where we need to run a double-blind clinical trial. Well, you have no intellectual property rights, so you'll never do that. So there's kind of thing after thing after thing that's going to drive these products away.
And it's really a reminder that these are small natural healthcare product companies. These aren't giant pharmaceutical oligarchs like Pfizer, who has trillions of dollars at their midst, and they can pay out these lawsuits or these infractions. And I mean, they've paid out the largest criminal payout in the history of the United States for fraudulent claims. These little companies don't stand a chance, it seems, against any of these regulations being put forward by Health Canada that appears on the surface and below the surface as well to prioritize the pharmaceutical industry and chemical drugs over getting to the root cause and perhaps taking health into your own hands through more, I hate to use the word alternative routes, because those were actually the original routes and have now the script has been flipped that the natural health products are the alternative and the big pharma is the first go-to.
Yeah, no, it's quite interesting. Economists call this type of exercise rent seeking, where you basically increase the regulatory burden to the point where only big players are left standing, like a handful of them. So they find themselves in a quasi-monopoly and make a lot of money. And the regulatory body loves it because they're getting all these fees, and so they can grow and expand and kind of manage this. So it's a very synergistic thing for the large companies and the regulatory body, and it happens in other areas. But another interesting aspect is the cultural and religious aspect, because a lot of these traditions, our health traditions, are actually part of the culture. And there's actually also even religious tenets in some of these cultures to being able to treat yourself with their traditional ways. And we can even think of in Canada, our First Nations peoples. I mean, it's part of the culture and heritage. And that there seems to be no accommodation in just this move to the pharmaceutical model also. So there's a lot of considerations that are being left out. And the curious thing is when you think of the history, like how much consultation went into getting here. When the self-care framework was announced and Health Canada marched across the country, explaining to the natural health community what was coming, they said, well, these are non-negotiable changes. Like non-negotiable was the word. And they were non-negotiable because they came from a committee of senior management, as if that's an excuse not to have any bend or flex with a complete overhaul of a system we just spent 2 decades arriving at. And so there was a member of the industry did an access to information request. Well, who's this senior committee? And it was just 4 bureaucrats really with no expertise at all in natural health products. But some of them had clear ties to international trade. And then, another access to information request. Well, what evidence did they rely on? And there's nothing there. So at the nhppa.org, there's a discussion paper from 2017 on the origins of where this came from. And every document that they relied on in those ATIs is reproduced in that discussion paper. It's appended. People will be shocked how this is based on nothing. And then also right now, there's a campaign that we're just launching to put pressure on the MPs, literally to shut down their offices. And there's very clear instructions on what we want you to do and how, including letters and the whole thing that, if you don't want to write your own, we've got pre-written ones. If you do want to write your own, we've got the talking points and just pick some and the like. So we're trying to empower people. So, but when you go to the nhppa.org site, there's a place where you can subscribe to our newsletter. Please give us your email address because we're going to be launching campaign after campaign. And that's the way we alert you to the fact that we've got a campaign launched.
That's great. Well, thanks again for joining me. And hopefully this campaign is successful as were the 2 before it.
Thank you, Tamara. Really appreciate your interest.
Oddly, these changes come at a time that Canada's Minister of Health pushes through regulatory framework changes that gives chemical drug companies a free pass to bypass informed consent. Instead of having to prove safety and efficacy, the new changes mean that the manufacturers of novel products such as artificial intelligence, nanotechnology, and gene editing only have to show that the benefits of their product outweighs the risk. It's a move that many condemn as prioritizing industry over the health and safety of Canadians, with chemical drugs that come with real risks and real side effects. Well, natural health products and that industry sees yet another strike against it for products that traditionally come with less risk than getting struck by lightning. For Rebel News, I'm Tamara Ugolini. If the Liberals get their way, you won't be able to be empowered with information, whether that be from natural health products or from independent media. If you agree that state censorship and state-controlled media is a slippery slope to authoritarianism, then please consider supporting our work at stopthecensorship.ca. At that website, you can sign our petition, and you can also find out what we are doing to combat the increasingly restrictive government at stopthecensorship.ca.